Hi, my name is Kat. I'm in Tommy Passes' class. This is ROP Sports Medicine, and this is my ankle assessment. Alright, so the first questions I would ask is, I would get to know the patient, I would ask what their name is, what their age, and how are they doing, I guess. And so after that, I would ask some more detailed questions. So here they go. So what are the normal activities that they do? Have they changed or stopped any activities? What is their age, or what is the sport they play? And then if they do, what position? What are their occupations? And then what kind of shoes do they wear regularly? And then do they work out? And then another set would be what hurts? What are the activities that they do that hurts the most? Where does it hurt? When did they first kind of notice that, when they first noticed it, and then has it increased or decreased since the incident? And then what were they doing during that incident? And then was it an invert or evert kind of roll? And then how did it happen? Were they like running, or like were they walking? And then did they have to stop the activity? Now, I'm gonna also ask them, where does it hurt the most? And has the pain started or stopped? And then the types of pains that would be listed would be sharp, numb, tight, loose, or like a tingling. And then is there any swelling or discoloration? And then is it worse from when the incident happened, or is it still the same? Does it hurt to walk, squat, jump, jog, step, or go up the stairs? And then have they had any previous injuries? Have they had any surgery? What are the activities that and sports that they have done before? And then are they still working out? And when did they kind of first start working out? And then have they noticed any weight change? Alright, so after all these questions, I would do an observation of the foot, and I would look for any swelling or any discoloration, any bumps or anything, and if there's any bruising around that area. So after that, I will be doing the palpation, which is kind of starting point and stop point of where it starts to hurt. Like that I can focus more on where the injury actually is. So I will kind of feel around and see if it hurts anywhere on the top, on the side. See if it hurts like by the toes and everything, the bottom of the foot. Kind of everywhere. After that, I would make the patient stand up and kind of check their anterior view, see if the knees are going inward or outward. And then after that, I would kind of check for the lateral view and see if there's any swelling or anything back here or in the medial side. After, I would check the medial view, see if there's any arches, if the arch is too high or anything, or if they're flat-footed. And then after that, if they did, or if I wanted to check more, I would look at the posterior view and kind of check to see if they're going inward or outward. And then after that, I would make the patient walk around, kind of see if there's any disformalities or if there's any abnormal walking, which seems to be okay right now. Alright, now after that, if I had a gomiometer, I would kind of check out her range of motion. I would make her plantar flex, just pointing it inward. And then I would make her dorsiflex, and then go inward, and then outward, and then plantar flex, go inward, and then outward. So now I'm going to be doing the special tests, and the first one I'm going to be doing is the anterior drawer test, which you got to hold on to the tibia and fibula down by the ankle, grab the talus. It's not the talus. God damn it, Kat.
It's the calcaneus, huh?
Okay, so now I'm going to be doing the special test, and the first one I'm going to be doing is the anterior drawer test. So you hold on to the tibia and fibula, and you kind of pull like outwards. So it seems to be good. The next one I'm going to be doing is the varus stress test, which you do the same thing, hold the tibia and fibula, and you kind of pull it inwards. And then same with the valgus stress test, and it's the same thing, except you got to pull it outwards. And then the next one I will be doing is the instability test, which is pulling it out and then also up. And then the last test that I will be doing is the interdigital neuroma test. And you kind of do the same thing, and then you grab this part to check if there's any fractures or anything that's broken in there.
My name is Lizzie and I'm doing an ankle assessment for sports medicine. So the first thing I'll do is have my patient come in and I'll ask them their age and their name, and then I'll start asking them all of the history questions. So what are their normal activities? Have they had to change or stop any activities? If they're playing any sports, what type of sport, what position they play, the type of training they do, their occupation, the shoes that they normally wear, the shoes that they work out in, what hurts, what activities hurt to do, where it hurts, where it hurts the most, then increased pain, where the decreased pain is, if they were inverting or everting their ankle when they fell or however they hurt it. Were they walking, running, jogging, climbing upstairs? Then I ask where the pain hurts the most. Was it a sharp pain? Is it numb, tight, loose, or tingling? Is there any swelling or discoloration? And then I ask is it worse now or is it the same? Does it hurt to walk, squat, jump, jog, step, walk upstairs? And then I also ask if they had any previous injuries, if they had surgery prior to their injury or after anything, if they're doing any new activities before or after their injury occurred. Are they still working out? Are they working out not at all, or if any? And if they had any weight change. Now after I ask all the questions, I'm going to do the observation. So I'm going to be checking for any bruising, swelling, discoloration. You can check the toes for anything, check the bottom of the feet for any calluses, make sure there's no warts or anything. After the observation, I'm going to start the assessment, so I'll have her stand up. And I'll have her turn so we can see the front, and we're checking her knees to make sure they're not too in or too out. Then I'll check the medial view. You have to look and see. And we're checking for if her arch is too low or high, or if she's flat-footed. Then we'll check the lateral sides, turn all the way. And then we're checking to make sure everything's straight, nothing's wrong. And then we'll check the back side. And we're looking at her knees again, make sure they're not too in or out. Make sure her ankles are all straight, you don't want them crooked or anything. Everything checks out. And then I will have her walk so we can check all that. And this will show if there's any injuries or anything like that. And her walk is good. So now if I had a gomiometer, I would be able to check her range of motion, which is where we'll line that up right here, and I'll have her plantar flex her foot as far as she can. She'll dorsiflex her foot, and we will invert and then evert her foot. So now I'm going to be doing the palpation, which is to help me pinpoint where the exact pain is, where it starts and where it ends. So I will go through her leg, through her ankle, checking for any tightness, tenderness, check her toes, and again, this just helps me to pinpoint where all the pain is and if there's any tightness again, looseness, if it hurts, where it hurts the most for her, and she'll be able to tell me exactly where it's at. So now I'm going to be doing the special test on Hannah's ankle. So the first test I'll be doing is the anterior drawer test. So I'm going to hold right about here, and I'm going to pull. Well, first I have to plantar flex her foot about 20 degrees, Then I hold and pull her foot outwards, checking to see if it's loose or it could be too tight. The next test is the Varus stress test. I hold here again, hold right about here, and push her foot inward. Then the valgus stress test, I'm in the same position, but I pull her ankle and foot outwards. Again, checking for tightness or looseness, or if I hear any pops or anything like that. Then I'm going to do the instability test, so I'm going to pull outwards like the first test, and then I push up. And the last test is the interdigitoral neuroma test. And I'm going to squeeze her foot, holding here and here. And if she did have any injuries and me squeezing this, she would have pain and you'd be able to tell.
Hi, my name's Hannah Perry. I'm in Tommy Pass's sports medicine class and I'm doing the ankle assessment. To start off, I'd ask the patient what their name was, how old they are, what activities they were doing that caused the ankle injury. I'd ask if they recently had to change or stop their activities because of the injury, what occupation they were in, what sport they do, what position they're in, what hurts the most to do, what activities hurt the most, when they first noticed the pain and what they were doing at that time, if they could invert and evert their ankle, if running or walking or jumping hurt. Then I would ask where it hurts the most, where the pain starts and stops on the foot. Do they have any signs of numbness, tingling, looseness in their foot? If they can see any discoloration or swelling, does something make it worse? Does it hurt to walk or squat or jump, jog or step or go up the stairs? If they've had any previous injuries leading up to this, have they ever had surgery on their foot? Are they still able to do their sports or activities? Have they recently had any weight changes? Next, I would move into observation. I would look to see if there were any bruising or swelling. I'd check for any calluses or warts or any obvious deformity. Next, I'd have her stand up to show the anterior view. We're checking the knees for any bowed-leggedness, so if her knees were pointing inward or outward. Next, I'd have her turn to show the lateral view. And here we're checking for straightness and if there's any bruising. Next, I'd have her turn to show the medial view. Here we would be checking for, again, straightness, everything's aligned. If she has flat-footedness or too high of an arch. And then I'd have her turn to show the posterior view. And here we're checking to see if she did have a problem with her arches. It would show in her legs, they would bow out or turn inward more. If I had a goniometer, I would use it to check her range of motion. I'd have it align with where the joints meet and check for dorsiflexion and plantar flexion, how much she could invert and exvert her foot. But since we don't, now I'll be doing the special test to test for any loose ligaments in the ankle. The first test is the anterior drawer test. I stabilize the tibia and fibula and grab the base of the heel and pull outward. The varus stress test is in the same position, pulling the ankle inward. The varus stress test is again in the same position, just pulling the foot outward. The instability test is in, again, the same position, pulling out and up. The last test is the interdigital neuroma test, where we just simply squeeze the foot to test for any obvious fractures or pain.